Welcome to Voices of Care, the podcast series from Newcross Healthcare that seeks to get to the very heart of the issues facing the UK health and social care sector by speaking to leaders who are truly enabling the healthcare workforce of the future. I'm Suhail Mirza, and I'm delighted for this special episode of this series to welcome the CEO of Newcross, Stephen Pattrick. Stephen, it's a delight to have you on the series. We started this 3 months ago, and it's been a very busy period for you in terms of Newcross and the innovation and the development of the business.
Yeah, and delighted to be on the podcast with you, Suhail. It's been it's difficult and complex environment that we're all living through at the moment for a variety of reasons that we don't need to go into right now. But of course, as an organisation, we have got a growth and change strategy as well, it's been a really exciting time. And we're really excited about the future and the impact that we can make within healthcare and the lives of our clients and our staff.
Absolutely. Now, one of the big issues, of course, is that we are in a new epoch of care, community-based care, hospital at home. Technology is seen as a huge enabler by policymakers, by providers. I know that's a topic with which you have particular allegiance and huge passion for.
Yeah, absolutely. And of course, technology is there's huge opportunities coming, the like of which we've never been able to even comprehend, let alone experience. And so it's a question of how, as you say at the beginning, how do we harness those technologies, enable and implement those technologies for the betterment of society, and create technologies that are going to make a real difference to people's lives. And of course, in implementing new ways of working, new technologies, and is difficult, but absolutely essential. And I guess our focus as an organisation is quite rightly the development of our services with a lot of focus on technology to improve outcomes, lower costs, and actually make more of an impression in terms of the amount of staff that we can supply, the amount of services that we can deliver across the country, and indeed Europe and ultimately the world.
Now, the NHS is facing a profound crisis. It's all over the press, particularly in terms of patient waiting times and clearing backlogs. We've had the urgent and emergency care plan issued, more ambulances, more funding. But particularly, I wanted to focus on the drive to grow the presence and ubiquity of virtual wards to get to 50,000 patients per month in 2024, 2025. This will require technological innovation. It will require a workforce that can be technology agile. What do you think of this initiative of moving and shifting the delivery of care into virtual wards, into people's homes, into the community?
I think it's absolutely essential. And we spoke about this at the Langenbusen conference where we first said hi. We know that there's trials operating at the moment that seem to be operating very successfully. But this is absolutely essential for the future. We know that people who provide care or have care provided in the home have better outcomes. We know that. So I think this is the future. And of course, as you said, we need agile systems and an agile workforce as well, because of the flexibility in the way that you would operate virtual wards. And so that does need a different change in approach in the way that we operate and manage services. But I think it's brilliant for the NHS, and I also think there's an opportunity within the private sector to provide virtual wards, and also obviously for private hospitals as well. They have the same demands and the same requirements. So we're really excited about that. And as you say, we talked about this earlier on last year. And we've already launched our home clinic and actually developing solutions through the home clinic to actually provide our virtual wards in the homes as well. So we're totally aligned, and I think that's going to be part of an important part of the framework of care for the future for people in the UK.
And that's part of the wider commitment and mission of Newcross in terms of democratising advancements in treatment and care at home, and to enable that. And that also implies having a workforce that can actually be literate in in technology and the advancements that are going on around the world.
Yeah, I mean, in terms of the advancements in treatment, we know they're coming along the line. The costs of some of these treatments, are frankly eye-wateringly expensive. We know there's a lot of drugs coming that's going to pass through NICE that at this moment in time, I think it's going to be very hard to be afforded. And so how can we help democratise that? One thing we can do is look at how we can diagnose an early diagnose conditions. And this really falls back to, my passion about delivering care and delivering services before you're ill. It used to be a joke when I was at school. There was this joke where it said, I went to the doctors the other day and the doctor said to me, well, I haven't seen you for a while. And I say, no, I haven't been well. But actually, there is something in that now where I believe that you should be going to a doctor at certain key stages and points, even when you're not well, even when you are well, beg your pardon, even when you are well, to have diagnostics undertaken at the most appropriate time for you, your condition, your age, etc., to ascertain your current state of wellness and then plan for the future. Now, maybe that initial cost will be slightly higher to implement than at the moment, but the long-term benefits are absolutely indescribable. So I think in terms of wellness, it's going to make a massive difference. And in terms of costs, it's going to make a massive difference. We know, of course, if you can treat early, it's usually cheaper and the outcomes are much better. So we need to take that to the next stage using, the amount of opportunity we've got for diagnostics. And one of the reasons we made an investment in Fountain Life, an American company that's just doing amazing things with diagnostics and state-of-the-art diagnostics, where at the moment it's frankly quite expensive in America to have those, but I think there's a way that we can democratize that and bring those opportunities into the UK to radically change how we deliver the care. And let's be honest as well, that healthy society is not only good for society, it's good for the bottom line, GDP. So it's good for the economy, it's good for people, it's the right thing to do, and it's all about having that quality of life. And so we're super excited about being part of that, and as we go through the years, developing our services more and more to the needs and requirements of the UK and the world in general as we move forward.
As you say, there's an imperative, of course, to deliver care. There's a demand is inexorable, but there's also budgetary constraints, some reality that we have. And so prevention is better than cure, as we say.
Yeah.
And I wanted to take that. That was one of the themes. The Voices of Care series has had gracious feedback. It's been covered in the press nationally and regionally. Stakeholders, workforce have been gracious in their response. This was very much your vision in creating the series. And just wanted to touch upon, was it to drive the debate? What brought you what was the genesis of the idea of having? It's quite a bold move to be able to engage the whole of the health and social care landscape to discuss these challenging questions.
Yeah, look, we just want to be one part. We thought we could do something, when you launch a business that we did 26 years ago, and you have an ambition to grow. As you develop and as the business develops, you get to a stage where you meet a lot of people, and you meet a lot of very passionate people, and a lot of, we said before, great intellectual capital. And that still somehow on the ground, it doesn't seem to be working, and nothing is changing. So we didn't want to politicize this. We just wanted to speak to people who have a deep, meaningful vision for the future, who are passionate about delivery of care, whether that's private or within the NHS, who share a desire to try and make a difference. And maybe through these conversations, it can help open up the mindset, opportunities, and in some cases wallets, to create a new landscape for care. There's a lot of opportunity It's tremendously exciting. Yes, there are difficulties, but I truly believe that healthcare in the UK, through with the NHS and also private, has an amazing future. We're very, very good at it, and we are so lucky that we've got the NHS and also some amazing private services as well. And how can we type of ensure that in the future this can develop into a super wellness delivery program? And I think, of course, we've got the short-term issues we've got to deal with now, of course, and some of what I'm saying may to some people seem blue sky, but we have to have that because we cannot keep on doing what we're doing. I think there's some short-term things that we can do in the short term, but we have to radically change our whole mindset towards care. And, the NHS was formed a long time ago, and it's only right that certain, just like any organisations, has to do a reassessment about how can we deliver what we promised to deliver? How can we work differently? What opportunities are here? And that's not saying they're not doing that, by the way. I'm just thinking that I believe we need to move faster and look for a society where, where people are generally, everyone knows the position of their own health and wellness. And we talk about being their own CEO of their own healthcare, their own wellness. So they're in charge of how well they are. They understand exactly what they need to do. They have the right information to make informed choices about their health and wellness. And ultimately, we have a healthier, fitter society, and a society that is going to live longer. And it's not just a question of how long you live, but it's how well you live. And those two things need to be absolutely, really, really arm in arm. And with the advancements in treatments, we are going to be able to live a lot longer and weller than we've ever done before. And with that, also, there may be more requirements for medical intervention, but also there's a cost. And how we're going to afford this. And I think we need to reassess our working lives, because I think that's a big issue. And we know one of the things we talk about is that every year, if you extended the working life of your own working life every year by 1 year, there's a 1% GDP improvement across the country. So it's a huge opportunity. And again, the advocation of type of working longer to some people seems a little bit controversial. But if you're retiring at, say, 60 or 65 or 67, and you have another 35 years of good living, we have to work out how that's going to be funded. And so I think we need to talk about a social contract that we have, that, look, if we are able to keep you well, live longer, then you probably might have to work a bit longer.
No, absolutely. And I think, as you say, the series has allowed us to address questions that perhaps others are not asking. Think outside the box, blue sky, sometimes you've talked about. And the longevity point you've just made, I'd like to touch upon a couple of the themes that have come out from the series and the podcasts that have been published, because I think they're fascinating. The longevity point, definitely, Professor Martin Green at Care England, he said that it's time to celebrate longevity, invest in that, and see the contribution that people can make who are living longer. Same point from Dr. Jane Townsend at the Home Care Association. But the collaboration point that you make in terms of industry, government, the NHS, social care, a couple of themes that have come out very strongly, which I wanted you to get your views on. Sir David Nicholson talked about the idea that the spirit is now moved into collaboration, the need for greater collaboration with ICSs. We had Neil Carberry from the REC talking about how the private sector can help in terms of labour shortages by working in partnership with the NHS and social care. And as you know, it's been several years now since the NHS set up its entrepreneurship programme to drive innovation in diagnostics. So this idea of collaboration, partnership, it's something I think it's very close to your heart and something you've advocated for a long time. And it's coming out from the luminaries that we've had the privilege of talking to.
Yeah, I mean, in my 26 years, I've seen different type of relationships from, potentially outright adversarial to very much collaborative. And I think there needs to be an admission that the private sector does do a very good job and do very good work. Mm-hmm. So does the NHS, of course, and so do many charities. So my view is just measure on the results. Let's just measure on the results and decide what is the best format, best value for money for the taxpayers, if we're talking about the NHS. We know that many, many people are choosing to take private insurance or pay directly for private consultation or operations because of the current environment. So even at the moment, there is a type of, although I think there's more people than ever before who are going private because they simply can't wait any longer. So I think the whole funding issue, and I'm frankly not qualified to go into the details of the funding. We just know that it needs to be a complete revision of how the NHS is funded, and I think we need to again be very brave and recognise that we need to make big changes. And I am quite heartened by the fact that two main political parties, both primarily Labour, are actually saying we need to change. We need to change, and there's nothing wrong in that, and it's required and necessary. So I'm quite heartened by the fact that it seems to be that there is a general political census that things can't stay as they are anymore. And it's just now a question of let's just start to map out what we need to do and get on with it, really.
And let's melt away some of the boundaries that we have between private and public and collaboration from industry and government. One of the other themes that came out strongly from the podcast that we've shared, people like James Tugendhat, the CEO at HC1, of course, as you know, Rainer Summerson at Agincare, was the importance, and you touched upon it earlier, of ensuring that we have proper well-being and wellness support for a workforce that has gone through tremendous challenges, is still facing health challenges, whether it's physical or mental or financial. And you've alluded to the economic value. Now, the Mental Health Foundation and the London School of Economics produced a study last year showing that it costs the economy up to £118 billion in terms of mental health problems broadly. Again, it's another topic which I think you and Newcross have played as central to your vision for how you can support the workforce and enable the workforce is through well-being.
Yeah. I'll be honest, I didn't initially recognise how affected our workers, colleagues, were by COVID. I knew they were affected, and we knew we needed to do something. And of course, we within Newcross, we have support services. There's a confidential 24-hour telephone line where they can get where they can provide mental health support and help them. We have doctors. There was already you can get GP appointments online. It's free with our app. With all our stuff. So we had all of that. But we felt that we needed to take it one stage further. Instead of saying, well, the door's always there, you can walk through it. Let's actually bring something to them. And that's obviously when we started working with you, where we held these podcasts or held these type of video casts. And the response was absolutely incredible. And we also surveyed to really understand the type of mental well-being of everyone. And it was pretty frightening how affected everyone was. And that's when we thought we were going to have to do something here. Mm-hmm. And that's when we thought, well, actually, how can we help everyone? This is not something that we want to hoard to ourselves. Working with you is great, but actually we need to share that and actually really work for society in general, share, see if we can support more people. And that's why we decided, and we got on very well, how we could develop free training. I didn't want to put a barrier based on price. on health and well-being. And so it was a great privilege that you joined us. And I don't know how many thousands of people that we've already hopefully helped, but the feedback and response that we've had working with you on our program has been absolutely phenomenal. And I know so many people have felt confident to come and say, I can't, this has made such a difference to my life. And so, it's something that we will continue and we want to make free. And of course, we'll talk about Future You in a moment, but I mean, that's something that we want to make ubiquitous to every healthcare worker throughout the whole of the UK.
And it'll be a privilege for me to be a part of that. And I think any organisation that can support the wellness and well-being of the healthcare workforce beyond its own boundaries, which is what you are envisaging, is, I think, something that should be emulated and thought about. Conscious that we're now going to look forward a little bit, the podcast series, we've got a number of guests coming ahead, which are spanning the entire landscape of health and social care. One of the big themes that we will cover, we've got the CEO of the General Medical Council coming along. We've already had Sir Julian Hartley, the NHS provider's new chief executive, and they emphasised the importance of retention and attraction through learning and development, through allowing people to have career paths, whether you're a carer, whether you're a nurse, a doctor, in order to grow the workforce domestically that we need in this country. Now, one of the things, again, it'd be important for people to realise that your vision has also encompassed the idea of being a learning partner for life for all of the healthcare workforce. And that means providing free training for those that want to enter at whatever level in the workforce. And they don't need necessarily, it's not conditional on them continuing to work for Newcross. No. Can you explain the genesis of that? Because that's a bold vision, and it's been extraordinarily well received, as I understand.
Yeah, I think it's just about a mindset change. So instead of having a society that's based on rarity, you create society based on abundance, and that forms every part of your mindset. And one of those is education. And at the moment, generally, but specifically, within healthcare for us, I felt it was totally unfair that if you wanted to be a nurse or a doctor, that you had to pay for it because you're absolutely in demand. We are desperate for them, but then we make them pay. It's like, I don't really understand it. If you wanted to do something that there wasn't a demand for, maybe, fine. You have to pay for that education. Ultimately, I don't think you should, but maybe initially. But not with something as important as this. And I think, this is not political because I think it goes over, all parties. I just feel that we've lost the focus on what we need to do as a society in terms of education. And also the way that the world is moving is so fast that you cannot just, your life has to be one of constant learning and innovation. And so it doesn't stop once you get your degree or once you get your qualification. It's just part of the journey. So your journey in life should be one of constant learning and innovation. And it's great. It's fun, So how can we make that great and fun and accessible? So we had the idea of providing free healthcare training and also an educational program, ultimately to take people to be right the way up to be a doctor and a nurse, completely free. And actually, I didn't want to create any binds or shackles to that. I didn't want to say, well, you have to work a certain amount of time or you have to work for us. I'd rather us create something that is completely free, open to everyone, and you make a choice where you want to work. And hopefully you might want to come and work with us, but maybe you don't. And maybe you want to go and work somewhere else. It doesn't really matter. I think there is a need and requirement. So let's just deal with that. And we'll work out how in the future we can continue to fund that. We will. We're funding this all ourselves. So we've launched Future You, as you know. We've got teams currently working on creating state-of-the-art training online. We're creating our what we call a meta university as well. But that's going to be coming in the future. But actually, we are creating training that's going to be completely free of charge and open to everyone. And I say that's already started. It started off as a moonshot. It's now become a reality, and we have teams now working, and we're expecting by the end of the quarter to have 20,000 people a month going through different training programs. So we're really, really, really excited about that. And it's something that I'm really, 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 really passionate about. And I don't want to have any type of levels or blocks. At the moment, if you want to train to be a doctor in the UK, there's only 7,500 people who places, because after that there's a block. We know, I think there's just over 20,000 doctors a year required. So the rest of those doctors are coming from obviously outside the UK, primarily Pakistan, India, and 2 or 3 other key areas, which is fine, and we absolutely thank them for coming. But reality is that really, just like oil or just like energy, not necessarily oil, but just like our energy, we should be reliant on developing our own nurses and carers, and etc., and hospital and doctors and consultants, etc. So I don't think that's sustainable. And in those particular countries as well, it's, there is a requirement in their own country. It's a growing country. There's a lot of requirement there. So I just think that, this is the beginning, and watch this space, because we're really excited.
I think without doubt we've got, as you say, 133,000 vacancies in the NHS, 165,000 vacancies in social care, and international recruitment has played a brilliant part, continues to play a brilliant part. But of course, there's an ethical dimension that we have to respect those countries from which we are taking talent and develop and grow our own talent. The government has set limits, as you say, so Future You could be a very important pillar. One final question, if I may. We're looking ahead at the series to come. We've also got the idea that the importance of innovation and new thinking. We had Sir Jim Mackey in the podcast series, as you know, who talked about the role of technology and how we need new thinking. Sir Julian Hartley at NHS Providers, whose brilliant work at Leeds Teaching has been award-winning. And there he drew on best practice at the Virginia Mason Institute in the US, how we can use industrial process of continual improvement. You have always thought as a culture that we should seek the exceptional. So looking ahead at the series, innovation will be a big theme that you expect the series to focus on.
Absolutely, and the term type of innovation, I think, is changing, because innovation is happening everywhere, around everything. Because we're digitizing our economy and societies, everything is becoming part of a digital experience. Everything is type of what you call a Moore's law. So everything is exponentially growing faster and faster and faster. And so we have opportunities and to see many changes. So, you look 5 years in advance or 6 years in advance. You look at some type of surveys, you know about the UK, it looks terrible. What's going to happen in the next 5 or 6 years? Others say it could be better. Frankly, the way the world is moving so quick, it's very, very difficult to actually pin exactly where we're going to be, because the opportunities and threats are going to be varied, but also different to what we probably expect to happen now. And so we just need to be very agile as an organisation. Agile, and create an agile workforce is very, very important, and that's really demanded. I mean, I hear a lot sometimes about, especially our Health Force Go. We've got our Health Force Go now. We've got 20,000 staff registered Health Force Go. We're expecting over 50,000 by the end of this year. They join us because a lot of people want to work differently to how they worked before. They want to work more flexible. They want to work under their time, and they want to develop their careers that best suits them and their family. And I think even, all society and all employers need to look at that. Look how we're working now in our organisations, completely different. A lot of people who have the opportunity of working this type of hybrid, working from home or coming into the office, working differently. That needs to be type of considered across the whole of healthcare. People don't always want to work type of specific shifts. So how do we as an organisation provide that continuity of care to our clients, to patients, whilst also meeting the demands and requirements of a workforce? Because if we do that, you're going to have more engagement, better retention, better outcomes, and a happier, more content workforce. It all sounds quite easy saying it like that. It's not. But there are some simple dynamics that we need to look at. Another thing I think that we could look at, for me, is a big thing. We pay same-day pay. The opportunity. So if you want, you can actually get paid on the same day you work. So this is basically for our type of, for our temporary nursing and care staff we provide in the community on a temporary basis at last minute when someone needs to work, needs a nurse or carer. The difference that we do where we are at the moment is that you actually only can pay 50% of whatever they earn. And that's because the PAYE scheme is designed for a week. So you can only pay people a week. So you have to save some because you don't know what type of tax and national insurance they're going to be paying at the end of the week. Imagine creating a workforce that is fully employed, that has all the employment rights, but still allows them a hybrid decision-making. They can decide when and where they work. But the way the taxation, primarily the PAYE, is worked out, that it can be calculated on a daily basis. You will create hybrid gig workers, but with the benefit of full employment rights. I think it would make a huge, huge difference to society. And this is not just within healthcare, but we've got a lot of people in healthcare who want to work in that flexible way. And I think there's a way that we can do that and create a much more, and of course technology allows continuity as well. There's so much more. And if someone really doesn't want to work, trying to force them to work, you're not probably going to get the best out of them. So how can we create that continuity, training, ensuring the training is correctly applied and they've got all the training, the outcomes are monitored and managed. We know the outcomes, and create this type of flexible workforce, which is good for our workers, great for our clients, and most importantly, a great experience for patients.
I think we'll have a lot of topics to cover throughout the rest of the episodes that we've got. But on that inspiring and engaging note, Stephen Pattrick, thank you very much for your time and your passion.
Thank you, Suhail.
If you've enjoyed this episode of Voices of Care, please follow, like or subscribe wherever you receive your podcast from. And if you want to find out more about how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you and goodbye.